Thanks very much, Chair. I was just taking on my timer there myself, and I want to thank our witnesses for coming in, and I want to thank you. It's 10, yes. And I want to thank you for the work that you are doing, and indeed that your members are doing in what I think some would describe as very challenging circumstances, what I would describe as disgraceful circumstances. And indeed they are no more worthy of the claps, or no less worthy rather of the claps and the applause than other frontline workers. Can I just go back to the point that was raised by Ms King in relation to making COVID-19 a notifiable disease? And I absolutely welcome the support here this morning from deputies. I have a piece of legislation, if the Taoiseach is not minded to make the necessary and requisite changes, I have a piece of legislation which I published back in June, which will ensure that this is done. So I look forward to the support of people right across the House for that, because I think there is general agreement that if you contract COVID in your workplace, it's a workplace injury. It should be treated like a workplace injury. I don't know what all the ducking and diving on behalf of the government is about. Well, that's not true, actually. I suspect I do know what it's about, but I'm not prepared to go into it right here, and it wouldn't be helpful. But I have that piece of legislation. It's published, and I would welcome support from right across the House for this. Just with regard to what's happening at the moment, Mr Ennis, can I ask you in relation to waiting for test results? So we know that there's the turnaround times are going down, but we also know that that is primarily because it includes healthcare workers who are tested on site, whose tests are processed on site, and they're actually dragging down the numbers. In the meat processing sector, Mr Ennis, what's the wait for the results, and what happens when a worker is called for a test? Are they permitted to self-isolate, as we've been advised to do? Are they given a place to self-isolate? Are they provided with money to ensure that, that they and their families can survive that? Thanks.
Well, unfortunately, Deputy, it's a tale of woe, because in the most recent manifestation of COVID within the meat industry, in the 3 lockdown counties in particular, I have seen and been made aware of situations where workers, as I said earlier, have been tested and allowed back into the workplace, and they didn't get the results in some cases for 4 to 5 days. And I believe some workers who were tested last week. Sorry,
when you say allowed back into the workplace, that sounds like it's somewhere they were dying to get back into. Can you characterise what happens there? Are they afforded an opportunity not to go back into their workplace, or is it the case that they go back because they have to go back?
Well, let me make it simple, Deputy. The HSE would have carried out significant testing in a particular plant, so they would have been aware of a strong presence of COVID. I think 50% of a particular line, I think it was a lamb line, tested positive for COVID. But the beef line was still continuing, and workers were tested from that beef line. But when you blow a whistle in a plant, there's a lot of carcasses and a lot of, I'm sorry to be so graphic, lying about, and it's valuable product as far as the employers would see it. So those workers were tested, even though they would have been in a workplace where there was significant confirmed cases of COVID. They went back in without having first got the results of their tests, because, as I said, they had to wait 4 to 5 days to process that product. And then they find out belatedly that they have tested positive for COVID. So that's how bad it's been. So yeah, even today, I believe some workers in meat plants in Kildare have not got their results from last week. So the testing is a real issue.
So we're nowhere near 24 hours, is what you're saying?
No, and that is achievable. But can I just make this point, Deputy, if I may? The meat industry is probably the most regulated industry, except when it comes to terms and conditions for workers. Traceability goes back to the farmer. There are strict regulations on the movement of animals, veterinary inspections overseeing the slaughter and butchering of carcasses, right up to the consumer, and that is perfectly right and proper. But nothing but the statutory minimum for workers in many cases are little above. And I'll go back to the point about this issue of making it a notifiable disease within the meat plants. We need to amend that. We need that regulation reinstated.
Well, the good news is, Mr Ennis, that we've had expressions of support from at least one party in government, so here's hoping that it gets done.
Yep.
Just with regard to the conditions that the workers are working in, as some people will know, my father used to organise workers in the meat factories in the late 70s and early 80s. He told me about the conditions. It's really shocking that those conditions don't appear to have improved. In fact, if anything, they have gone the other way. I'm very struck by the fact that we talked a lot about vulnerable people in nursing homes, but we are not talking about the vulnerabilities in relation to meat processing. And you're right, it is a regulated industry. And I would say that, we have heard in the media that the workers are the vectors. I mean, the real vectors are the lack of sick pay. living in overcrowded accommodation, not being able to take time off work. That's what's actually acting as a vector in this instance. With regard to, Ms Lober, I'll ask you this, with regard to access to appropriate information, and I mean language appropriate information, what is the current situation? And I'd ask you to be brief because time is very tight, please.
Yes, if I may, we notice a chronic issue with this in that workers of different nationalities are brought in to work in factories in Ireland without any induction in their own language. Well, some employers do, but in some places there is no such induction, that they work in segregated teams based on nationality, so they have no opportunity to learn English. People are often working...
All right, Ms Lober, to interrupt you, my apologies. I'm asking specifically in relation to language-specific information that is made available to people relating to COVID and the precautions.
Oh, yes. So I would say that, for instance, for many meat plants we know where workers are employed through agencies, they would have received a text message or an email from their agency, very brief, often only in English, about whatever the PPE that they're going to receive, often even with no instructions in their own language as to whether, let's say, the face mask was reusable or single-use or essential information like this. So sometimes I had workers call me and ask me with a photo of the mask to tell them, okay, can I reuse this? How long is it good for? Because no such instructions had been given by the employing agencies. So I would say that in terms of like translation and everything, it has been dismal. And while maybe for some communities that have been in Ireland for longer, like the Polish community, maybe the factories have some available translation or have supervisors who already are from that background and speak the language. For some other recent arrivals, such as many Chinese workers, let's say in Munster, there is very little support, and or same for Brazilians or East Timorese or other communities.
Yes, so we know it's a very diverse workforce, but the information that's available is not available in a diverse range of languages. We can hear that. Mr Ennis and Ms King, would you like to comment on the remarkably high levels of asymptomatic cases, considering we have a 10% infection rate among meat processing and food processing workers, and yet we appear to miraculously have some of the highest asymptomatic presentations certainly anywhere in Europe that I have seen. If you could comment on that first, please.
Yeah, I raised that last Friday at the meeting, which was attended by the acting CMO, and I found it actually somewhat incredible that this, I mean, I said it, do you think that this virus picked out this group of people so that they would have a much higher rate of asymptomatic than other groups? And I have my own view as to what the narrative here is, but the narrative from the employer side was very clearly that people were asymptomatic, therefore they didn't know they had it, therefore they were in work even though they had it, and so on. But the point on all of this is, any of us in this room could be asymptomatic, we could have it, we could get tested. But the point, and I'm supporting the viewpoint that Mr Ennis has given in his evidence, once the virus has been detected, there should be a quick-fire procedure that's implemented immediately. The HSA should be there to the front, making sure that that's implemented. That should include closure until the virus is eradicated, and at the very least until all the workers have been tested and you know the extent of the viral contraction. Now, you saw yourselves, and it was public, that is not what happened in these meat plants. In fact, you had one company who actually were instructing workers, albeit that 9 people had been identified as positive. The rest of the workers were out for testing. The testing had been started, and they were all told to come to work on Monday. It was late Monday evening or early Tuesday morning before the chief executive. That company is owned by a private equity group, and it was Tuesday morning before those workers were told, well, we're going to close the place.
Well,
now, what does that
scenario, Ms
indicate?
King, should those people be compelled to close? I note the Minister for Health over the weekend, fairly unhelpfully actually in my own personal opinion, he offered a personal opinion, but in actual fact that's all it was with regard to the closures. are you saying that we should have the capacity to shut individual plants, to do it quickly, test the workers quickly, get them back to work quickly, and that's not happening at the moment?
No, what we're having is we're having a variety of things. For instance, some employers say we're having a deep clean. What does that mean? How valuable is it? It's a bit like temperature testing. We're now told temperature testing is actually not that valuable. So what we have to have is a tried and trusted, agreed with the HSA, led by the HSA in concert with the HSE public health officials. We need to have that so that every employer and every worker knows exactly what the process is when there is a case identified.
Thanks very much, Ms King. And I'll just conclude on this because it was said to me last night when I was out canvassing. I met a lady and she threw her eyes up to heaven. She said, is there anything to be said for another beef tribunal? So we'll see. Thanks very much, Chair.